Dentalization of N's, L's, T's, and D's can also be another sign of abnormal oral posture and oral movement. Dentalization means the tongue presses forward into the front teeth when it produces those sounds. The normal, ideal position of the tongue during those sounds should be the alveolar ridge. So the alveolar ridge is if you find your front teeth here with your tongue and you slide back, there's a little bit of a drop. Okay, that is your alveolar ridge. N, L, T, and D should all be created from contact at that location. If someone is dentalizing those sounds, what you'll notice when they speak is you'll see more of their tongue than you would on most people. So as the tongue presses forward, you can visualize it a lot more as an observer. This is a very quick assessment to do on your child or yourself. Just watch yourself speak in the mirror, or have your child have a conversation with you and just really take note of where their tongue is going during those sounds. You could also ask them, depending on their age, if they can say N, 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 T, 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 D, 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 L, L, L. And you'll notice, then they'll notice kind of where their tongue is falling there. The reason this matters is because when someone is dentalizing those sounds, it typically is a sign that they have a more anterior resting position of the tongue, so the tongue is pressing into their teeth most of the time. That's not ideal because it can affect the positioning and the forces acting upon the teeth and the palate. Remember, as we talked about in previous sessions, the tongue should be resting on the spot, or the incisive papillae, which is not touching the teeth, but slightly back. And if you swipe your tongue side to side, you'll feel that little bump. That is the area at which those sounds should be produced. If you're noticing dentalization of these sounds, just note it on your self-assessment form and take it into consideration when you're doing the rest of these tests. If there are multiple abnormal signs, it would definitely be worth contacting a local myofunctional therapist who may also be a speech pathologist, but that's not completely necessary. If there's a myofunctional therapist who evaluates you and they see the need to refer out specifically to a speech pathologist, they will definitely do so. If you have any questions about this test or any of the previous ones that we've done, please write your question in the section below, in the comments section below. Find me at summerspt.com or reach out to your local myofunctional therapist. If you would like a full myofunctional therapy self-assessment form to use as you follow along with these videos, please click the link below, enter your email address, and a full myofunctional therapy assessment form will be emailed to you.